All right, so this project, I'm just going to re-explain it to you.
Okay.
We're discussing the impact of illness on patients, families, and nursing.
Okay.
So you have a very unique perspective as you are both the family and the nurse.
That's true, yeah.
So you get to see it from two different angles, which is very rare. So we just wanted to use you for that.
Thank you.
So if you could go ahead and give your name and background of your nursing experience.
Okay, so I'm Sandra Turkelson, and I've been in nursing a long time, and I've done a lot of different things. So I started out in the intensive care unit when I graduated, and I graduated from a diploma program, Christ Hospital School of Nursing. Started working in the intensive care unit, and then it was specifically surgical ICU, but we had a lot of the cardiovascular patients, and I just grew to love that area. So then I was asked to join the cardiovascular team, where at that time it was a few nurses who actually talked to the patients before they went to surgery, got them ready for surgery. We put the big central lines in their jugular veins, we put arterial lines in, we got them into the operating room positioned right on the table, etc. Then after surgery, we recovered them for the first hour or two. Then we transported them to the intensive care unit. And then in the ICU, we would go up the next day, draw blood gases, and do all that. And then before they went home, we would talk to them and did all the discharge teaching. So I did that for a number of years. And then I went into the role of a critical care educator, did that for a while. Then I was given an opportunity to go to a rural hospital and be the director of nursing. I knew the administrator that just went there, and he was really wanting someone to come out there that had a lot of clinical experience, because the hospital at that time had a bad reputation, and he was wanting me to do something. So I went out and used my clinical experience and the management piece that I learned along the way, and I was there for 4 years, and not to brag, but I think I did really help that hospital kind of turn the corner a little bit. And we did a lot of neat things in nursing, but then I just missed the clinical piece in the open heart surgery so much. So I came back to Christ Hospital again, and then worked there as a clinical specialist, because by that time I had gotten my master's degree. Oh, my bachelor's and then my master's along the way. It took forever to do all that for me, because I did that part-time, because I was working full-time. So then the surgeons asked me to join their group. So I joined their group, plus the hospital also had me be their case manager. So I did that. But then, because I had Ashley, and Ashley had a lot of disabilities, I was just not able to do all those hours. And there was no place that I could find that would take her during the summer. So I had to find a job that I had the summers off. So there was actually a school nurse position available at our district. And so I became a school nurse, which was great. I had my summers off. Well, then they started having financial difficulties, and so who goes during those times of difficulty in a school system? It was the nurse. So I was RIFT, reduction in force. So now I had no job, but I needed to still work, and so this is awful. So I started thinking, okay, what can I do where I would have my summers off? Could I teach? So I sent resumes out to all the area colleges and universities on the eastern side of Cincinnati, because I live out in Claremont County. And NKU called me, interviewed me, and I accepted. And so I've been here now 15 years. So that's how I ended up here. Isn't that bad? Because I needed my summers off. But I did, because that is a real big problem when you have a child with disabilities, is where can they go during the day if the parents need to work, you know? So that was part of the issue. So that's my story of my work history.
Okay, can you go ahead and give us your daughter's background?
Yeah, so Ashley is, she turned 24 in August. And so when she was born, there was nothing discovered that was wrong. And so I thought I had a healthy child. And you know, that last ultrasound, they did say that, you know, the head size isn't quite where it should be, but it wasn't anything too bad. And so they said, you know, there's really nothing to do, so let's, you know, we'll see what happens here. So, you know, she was born and she looked great. I remember the doctor saying to me, I checked the bottom of her feet, she's got all those wrinkles, that's a great sign. okay. You know, I really didn't know that was a great sign. But you know, in the hospital, I questioned, like, her ears were a little different, one side to the other side. And they said, nothing to worry about. And I don't think that really was anything to worry about, but that was an observation I made anyway. So then, you know, we took her home and thought everything was just fine. And in a way, I'm just glad it turned out that way, you know, because in the beginning I thought, yeah, everything's just fine. And so I enjoyed all that, you know, in the beginning. It was just fine. But then I noticed that she was my first child. So, you know, I didn't pick up on things that my family was beginning to pick up on. Isn't that interesting? Because they had children and they kind of saw that she wasn't maybe developing just the way maybe she should have. But that being my first child, and I didn't teach peds, I didn't know. So anyway, but what I did notice, she started having these little tremors of the arm, the right hand, little tremor. And I'd think, what is that, you know? So I'd call the doctor. And so, of course, the pediatrician would see her, and he had examined her in the office, and he said, don't worry, Sandy, everything's just fine. Go home and enjoy this healthy little girl. Okay, so I did. But then one day, my sister was babysitting for her, and she must have had a much bigger seizures, what they were. And so she said, Sandy, this isn't right. Plus, they were questioning, was she really following things right with her eyes? So again, I took her into the doctor and explained that to him. So then he got a little bit more concerned. And then all the testing started. And all the testing they weren't coming back just right. So the EEG was the one test that was abnormal. Blood work was normal. But since the EEG was so abnormal, then we went on to the CT scan, abnormal. Then went on to the MRI, abnormal. And then we knew we had a big problem. So then all the appointments started with all the doctors, with the neurologist first, and then it went on from there. So right now, we probably have 8 specialists with all the different problems that she has, because as you get older, more things continue to, you know, be issues, things that you would never have thought about when you were 3 months old. So she was diagnosed probably at 5 months of age. And the pediatrician in the beginning didn't think anything was wrong because, you know, he says it takes a year for the neurologic system to fully develop. So he wasn't overly concerned in the beginning. But then when we finally went and had the tests done and they were all coming back abnormal, then he knew we had a big problem.
So can you discuss some of her disabilities with us?
Yes. So early on, they don't know how, even with this condition, polymicrogyria, and that's where the gyri and the sulci of the brain just don't develop properly. There are too many of them. They're very thin. They don't go deep in the brain. And so in the beginning, they said to us, we have no idea how far she will develop. And so with that, we took off with OT, PT, speech. We were doing everything. We were just running all over the place. And if I didn't have, at that time I worked for the cardiac surgeons. If I didn't have that job with them, I would have died. They were so, it's whatever you need, just go do it. And so they knew I was a great employee, I would get that mixed up, employee, but they also knew I had a child with many needs. And so they just told me to do what I needed to do. So we were going to all of those therapies. And finally, I'll never forget this, at age 3, we were seeing the orthopedic doctors too, because of, you know, they have a lot of spasticity and some tightness of joints, etc. So we needed to see the orthopedic surgeon. But he finally said to us, and you know, you really appreciate doctors being honest with you. And he goes, you know, Sandy, she's 3. And if she's not going to be turning over at 3 and crawling by 3, she's probably not going to be doing any of that. And so that finally hit that, you know, I realized that this was probably as far as she was going to be developing as far as motor skills. So she can't roll over, she can't sit up, she can't do anything on her own. She, unfortunately, with this diagnosis of polymicrogyria, where the brain's not developed properly, seizures is a big problem, and that's one of her biggest problems. And so right now, we're on 5 anticonvulsant drugs. That's a lot of anticonvulsant drugs to be on. So they start with 1, then 2, 3, 4, 5. We even had the vagus nerve stimulator that it's like a little device that's put in, kind of like a pacemaker, and then the lead wraps around the vagus nerve, and then when there's seizure activity, it goes off and it supposed to help them like stop the seizure. I think that was helpful for a while, but I think the medications have been most helpful. So the battery's shot now, and they're not even wanting us to replace it right now because they don't see that it's helping that it helped all that much. Then with I think just the immobility part of it all, orthopedic issues have been huge. With her, so she has that neurologic problem that puts that big pull on the muscles. So one side of the body, I think, is more spastic than the other side, and so it kind of like puts a pull on, it was putting a pull, believe it or not, on the hip, so it was starting to pull the hip out of socket. So she had to have a big hip operation. That was like the worst experience ever, because she was in a body cast then for 6 weeks. It was the worst 6 weeks, I think, of my life. Because, you had to get up during the night, turn her every 2 hours, and she was miserable. It was just miserable. So orthopedic issues are big. Bowel and bladder issues. So she has some urinary retention. UTIs have been a problem. So right now, we cath her in the morning to empty her bladder, and then usually she's pretty good going throughout the rest of the day. And then we're on an antibiotic now, a maintenance dose of like Bactrim every night to help decrease with UTIs. We've been doing that for like the last year and a half, and that's been very effective. Bowel issues are huge with kids with neurologic disorders. Believe it or not, we're on Miralax in the morning, Senna, which is like a laxative liquid, and 2-ducal suppositories. And if she doesn't get all that, she won't have a bowel movement, and there are some days she still doesn't. So it's like it's a neurogenic type bowel and bladder. So those are constant issues. And then another issue that I never thought about, dental. So when you have, think about cleaning the teeth on a child like Ashley. But actually, she's not too bad with the dentist. So we go to the dentist, and they do a great job. They do the best they can cleaning. But if you ever would need a filling or anything like that, you really have to go be put under anesthesia to have dental work done. Who would have ever thought that, So, and now we're dealing with some wisdom teeth issues. So that's really scary right now. What's going to happen with that, I'm not sure. So those, I believe, are, ear. She's had chronic otitis media, and I think that's a lot from lying a lot on the right, and things just kind of drain in that area. And then she has a visual impairment. We're not sure how well she sees. We think she has some vision, but it's probably not normal vision, and it's not because it's anything wrong with her eyes, but it's the connection between the eye and the brain. So what is the brain really doing there? Swallowing is a huge issue. So we tried to feed her, and we did feed her for like 10 years, and it would take us at least 1 hour per meal just to get enough food in her, because it was hard for her to swallow, but she seemed to really enjoy food. I would smash up everything, I would puree everything, and she liked the bananas and the peanut butter, and so she was enjoying it. So they started talking to us about a G-tube, and in the beginning I thought, now who's this G-tube for? She seems to be enjoying it. I know it's taken us forever to feed her, but is the G-tube to help her, or is it to relieve us of doing, this task 3 times a day, 1 hour each? And so I wasn't wanting to do that because she seemed to enjoy eating, but then she stopped gaining weight. So she was stuck at 40 pounds for a long time. Finally, the pulmonologist, that's our other doctor we see, said to me, Sandra, she is at risk for aspirating. And I want it documented that I said that. I said, Dr. Wood, that's all I needed to hear. I needed someone to tell me she medically needed this G-tube. I'm a nurse, but I'm a mother. She was enjoying the food. She had never had aspirate pneumonia, so I wasn't wanting to go with that just yet. But once he said that, I was like, yay! Finally now someone has said she absolutely needs it. So we went with it. She immediately started gaining weight. It was so easy compared to trying to get food in her, an hour at a time. So that actually became easier, and she actually, I think, started looking healthier. So it was a good thing, but that was a struggle, I will have to tell you. And then pulmonary is a big issue with Ashley as she gets older. And so, part of me dreads the winter coming because of the respiratory viruses. And And those are sometimes the trips we have to make to the ER, and I think it's usually at nighttime, and she gets these little plugs, I think, and her O2 sats go down. And I do everything I know how to do to try to get her O2s back up, and if I just can't, then we have to go to the ER. And usually by the time we get there, because it's an hour's drive, and I think sitting up, bumping around, getting it, she's always better by the time we get there. But they're so nice, and they said, you did the right thing, bringing her, because it gets scary when you're at home in the middle of the night, and the O2 sats are hanging in the 80s, so. And she does have sleep apnea, and she is on oxygen at night, and we put her on her side. We did the CPAP trial in the hospital, and she just could not tolerate that at all. So I think those are her big issues. So the biggest issues would be seizures, pulmonary complications. I think those are the two biggies.
Okay. What kind of impact has this had on you? Physically, emotionally, and you don't have to go in depth, but I'm sure it's taken a financial impact on you. I'm sure it's, impacted relationships even with other people, so.
Absolutely. Gosh, I could go on for 2 hours. We probably only have 15 more minutes. Okay, so I have to shorten this.
Don't worry.
So the impact. Well, we really go no place because I work, all day, and I need to work. Because my husband worked 35 years at the Millicron, and then I was working. And one of us would always have the benefits then. Well, he was laid off at the Cincinnati Millicron when they had the huge layoff 5 years ago. So now I really have to work. Plus, I have to have benefits. That's the main thing, that health insurance. So we've been very fortunate that I have health insurance. And we also stumbled upon a waiver. It's called Home Care Transitional Waiver. And so it doesn't look at salaries, because a lot of those waivers, if you work, you don't qualify for anything. But this waiver didn't look at your salaries. This waiver was, we want you to keep your child at home. Not that I would ever put her away, because I would be dead before that would happen. But they want you to be able to manage your child in the home, and they want to help you be able to manage that so that you can continue to do that, because they know we're getting older too. So that waiver has been really good, because they came in and helped us with our shower. So now we have a roll-in shower chair that goes right to the shower. We have a lift device above her bed that can pick her up in a sling and then put her in her shower chair or in her wheelchair, so that you really don't have to lift her. So the nurse that comes during the day uses that all the time. Now, since I lift her like every day, and I have been doing that for 24 years, I actually am pretty strong. So I'm still able to pick her up out of her bed and put her in her chair, but she is 100 pounds. And so I know one day I'm going to have to use that lift too. So we do have it all designed so that you really would not have to do the lifting, let the lift do it. And we have then the things that we need in our home. We've widened doors. We've put ramps like into the back door and in the garage door, so that we're able to manage, Ashley really well at the home. But as far as going out then, since Judy is there, that's her nurse during the day, we have very little respite hours during the month. We have a total of 20 hours during the month time that we can use respite. And in the summer, we utilize that. We'll go to Home Depot, Lowe's, out to eat, things like that. In the winter, working all week, I only want to go out on the weekend because I'm tired, Because when I go home, I'm not finished working, Now the nurse leaves, and now Ashley is 24/7 care, because she can do absolutely nothing for herself. If she would have a seizure and her legs get crossed, she can't even straighten her legs out. So, you're constantly having to make sure she's positioned properly so that she doesn't end up with breakdown and things like that. So we really don't associate with really any friends. People don't come over. We've often wondered, is it because we have a disabled child? We ask that question. Why do people not come over to see us? So our family really is the only support we have. And my family, they live about an hour away, so they don't come over. We visit on Sundays. As far as finances, as long as I have my insurance and we have this waiver, it's been okay. We've been very fortunate because not everyone is so fortunate to have these waivers that will help with equipment. Or like Humana, my insurance will pay for most of the expense of that wheelchair that costs $10,000. The price of equipment is outrageous. It's supply and demand, so I guess, that's why, I guess. As far as Dave and I then, yeah, I'm sure it has affected maybe, although we never were people to go out much and party and stuff like that. We were pretty much homebodies, and so that's what we have done. We have tried to do things around our home to make it a place we want to be. So like we built this big pergola in the back of our house right over our deck. We have a hot tub, and that's Ashley's water therapy, with a big umbrella over it, We have all this landscaping done because we want our place just to be so enjoyable, and we love it, and we do enjoy it. And so, yeah, we spent some money on landscaping, but it's the best thing we ever done because we really want to stay there and enjoy ourselves, in the summer. And so I think that's been helpful, making it very nice to be there because that's our vacation, that's our place, and that's where we're at all the time. So we did that. Let's see, what else? Emotional. That's interesting, the emotional. Okay, so I went to a conference one time and they talked about the loss because you expect, in this article, Welcome to Holland, this little thing from Dear Abby, it goes into that. It's so you anticipate the birth of a healthy child. And so I was anticipating that, and I had it all figured out in my mind. I was going to not make her, but I was going to help her be the most diverse person ever. I had it planned in my mind. We're going to the art museum, we're going to the zoo, we're going to the farm, we're going to do all these things. I'm going to give her the most rounded experience a person could ever give a child. And then you find out that that's not going to be the case. So it's a huge loss. And so you go through those stages of loss, the denial, the being angry, and, the depression and whatever else, acceptance, I missed one, whatever. But what I learned was, you keep going back and forth through those steps. It's not like you go through all the steps and then finally you accept it and that's the way it is. No, you keep fluctuating. And so things will trigger me. One time I was going by a soccer field, little kids out there playing soccer. I started crying because I knew that would never be. See, here we go. So it's things like that. It triggers you. Say it. And you feel guilty all the time. Although, I'll be honest with you, I've never taken a drug in my life. I haven't even smoked marijuana. And yes, I like a beer, but I was smart enough to know not to drink when I was pregnant. I did nothing I knew of that could have caused such a thing. But yet, you feel guilty. What did I do? Probably nothing. But maybe, but I don't know. I'll never know. So you're always guilty. But I'm an up person, and if you were depressed about it, moped around about it all the time, what kind of life would that be? So you can't. So you look for the good. I'm always looking for the good. Maybe there's a reason. Maybe this is it, to teach all of you about things like Ashley. I use Ashley a lot in my examples. We talk about chaos care. I tell them you better never put a chaos flat on the table like they did Ashley, because then she developed a huge pressure ulcer on her heel, which to this day causes pain when you put a shoe on her foot. So I do use her a lot as examples. So, that's maybe the good that's come out of that. I don't know. I'm always searching. But it is emotional.
All right. How do you think that your personal experience has changed you as a nurse in your nursing practice?
Yes, I am such a caring, more patient, more understanding, more looking at that patient from all angles and the family, knowing that most people who behave badly in the hospital probably don't behave like that out in life, because I know how I can behave in the hospital when things aren't going right, And it's a lot because of the stress. It's a lot because sometimes people don't listen. And see, I'm a better listener now to patients. When they tell me something, I listen. Who knows those patients better than the family? If the family, is involved in their care, the family or the patient. And so I've learned that a lot. And I will have to say at Children's, that is one thing I've really have assessed or observed over the years. Those residents, I think they're being taught that or something, because they really do ask you, you know, kind of, how do you want to manage this? You know, sometimes I think, I don't know, you're the doctor, figure it out. But, you know, they really do want your input, which it's very nice, because who does know that child better than me? Everyone knows that. Me. No one knows Ashley better than me. And I will challenge anyone if they try to act like they know her better than me. So I am her advocate, and that's the other thing I learned. You have to be an advocate for your patient. You have to be that advocate. They need us. The health system will run over them if you're not their advocate. And she can't talk for herself. I have to be there for her, and I am. I'll tell you that right now. So what I've learned then is that you really need to listen from all angles to what that patient and the family's telling you.
Okay. What advice would you give to new nurses or nursing students regarding these types of emotional, physical situations that we may come into contact with as nurses?
Well, that's a good question. Well, number one, the listening and understanding that they know best, or they know more what's going on with that patient. Not to say they know best, and to be there for them. And I always like it when nurses, they're very supportive, but yet if there are things that they see maybe could be done differently or better, I love that input too. Not to leave them, to be there and to assist them. I remember one time we were in the hospital for several days, and it was pretty stressful. She was having horrible seizures then. And I remember doctors would come in the morning and say, well, how many seizures did she have during the night? Well, I was like, doctor, I have to sleep a little bit, you know? So I'm not exactly sure. So, and then sometimes maybe the nurses wouldn't come in and help because they knew I was the nurse, I was the mother, I could do it. I was getting so exhausted at the end, I couldn't see straight. And so one of our NKU graduates had just started there, and she was still in orientation, and she was with the nurse, and they could see I had nothing left. I was so drained. And so they immediately saw that they needed to do more of the care for Ashley. So I think being, you know, involved with the care, not leaving the family alone to manage everything in the hospital. Not that that probably happens a lot, but it was happening to me, and I don't know if it was because I was the nurse or if it was just that one particular nurse on nights. I'm not sure. But families need help. They need support. I guess that's the main thing, listening and being supportive, and that'd be the main thing, really. I'll probably think of more things driving home that I wish I would have said. I'll email you. You can add an addendum.
All right. That's it.